Listening to Action came into Gloucestershire Care Services January 2014. I have been in post for the last 11 months as a Listening to Action lead. For me, coming into post was about giving all colleagues a voice, especially on the front line, to improve patient care and to listen to what colleagues are saying so they have got a direct input into that care.
This year's been my first year involved with Listening into Action. I've been supporting a team of healthcare assistants and trained nurses at LiA Hospital, looking at ways we can enhance nutritional support on the ward in the inpatient environment.
These are patients that we couldn't get to eat, regular hospital meals, but giving them something different, and it's all yes, thank you very much.
It's about taking what they do and thinking, how can we do this more creatively, more constructively with the resources we've got. And people really rise to that challenge. They enjoy it, they want to take responsibility and control of what they do.
We chose Hope House because that's now going to be the brand for across all services. So you can go to Hope House Lydney, Hope House Cirencester, wherever we've got one of our community clinics. And the other thing that will mean is everybody will get the same quality of service that they get whichever clinic they go to.
Sometimes a journey through healthcare can feel like Alice's journey through Wonderland. Providing patient-centred service relies on listening to what our service users think about their experience of the care. So decided that an easy read leaflet, "How was your visit today?" was required, both of which you'll find on your tables.
I think that it captures the energy, the creativity, the talent and the passion that we have in our teams, and mixes it together, and the outcomes really are quite remarkable.
The purpose of Listening into Action is to try to give you the space and the support and the encouragement that you need to unlock the motivation and the ambition that I know you all have.
Constantly on a day-to-day basis I hear of how colleagues feel empowered, about the amazing work that's going on, and we don't always see that within such a widespread organisation.
It's quite inspirational. We've made some little notes on our table of other ideas we've had, and it's really great to see such a variety of things that have been done and how they've been presented today in a really different way.
One of the ideas is that we were looking at an interactive directory that will sit or will be given to the mother in the front page of the PCHR, which is very relevant to the area that she's in. What the internet site didn't have was a current directory of who the health visitors are in your area, who their GP might be, how to contact them, and maybe what's going on specifically to that area. Well, that's what we've changed.
LiA really has helped me develop me into the person in nurse that I am today, and without it I don't think I'd be stood here as a band 6 sister. Really, it's given me an awful lot of confidence.
It just improves patient care. LiA is great.
It's an enjoyable experience with the staff and it gets results for the patients.
It was a great opportunity for us to evolve and listen to staff and patients about what's helping well-being on the ward, and that's sort of looking at what can be done other than clinical on the ward.
Our experience of collaboration and co-production over this has been 100% positive.
Some really brilliant ideas that have come up here to benefit patients and us as staff as well. So yeah, I think it's been brilliant.
The clue was probably in the word big, because our mission is supporting and enabling service users and carers to lead healthier lifestyles.
Ultimately, whatever the staff do with the Listening into Action schemes and sponsor groups will directly impact on service provision for the patients, which obviously is important.
Somebody gave me this quote quite a few years ago for an interview, which I really like, and it says, "Leaders become great not because of their power, but because of their ability to empower others." And I think if that's one thing you take away, it is about empowering colleagues.
It's always about our patients and what we can do to make things better for our patients.
It energises teams, it unites teams, and it unites us in a shared vision of delivering improved outcomes.
We're here for the patients, we want to care for them, and this is one where we can really improve that.